Hi, my name is Zachary Town, and as part of this health equity lesson, we are going to review how to find treatment options for your patients trying to quit their alcohol use. So the objective of this session is relatively straightforward. It's being able to recommend resources for alcohol treatment to patients based upon their lifestyles and their preferences. So, first, I thought it would be helpful to go through exactly what is a treatment. So, comprehensive treatment for alcohol cessation includes multiple steps. It's rarely that one patient only does one particular step. Um, what we typically see first with moderate or severe alcohol use disorder is detoxification. So, this is going to be a process of controlling their withdrawal and making sure that they stay physically healthy. After there, we'll go through behavioral counseling. You may see medication or pharmacotherapies involved, and you will likely treat any co occurring mental health issues as well. And then in the long term, there's follow up treatment to prevent relapses. So, when would you refer a patient? Well, you should recommend any patient who has alcohol use disorder, who continues to use despite consequences of their use, either physical, mental, or social consequences, or if they have previously tried to cut back or to stop and have been unsuccessful, that may be an indicator that they would need uh, more comprehensive treatment. And it's worth noting that treatment works. 17 to 33% of patients were abstinent in the year following just one single treatment episode, and an additional 7 to 12 reduced their consumption and no longer had any adverse consequences. So, taking those higher bounds, we're almost about 50%, and that's only looking at a single treatment, not necessarily including those longer term, more intensive treatments. So, as far as actually picking a treatment, again, there are inpatient and outpatient treatments. There's pharmacotherapy, those medications. Perhaps the most well known there are the mutual support groups. And then finally, uh, just medical management counseling, which is the continued counseling from your primary healthcare professional. And it's worth noting that the American CARES Act stipulated that all insurance plans must cover treatment for substance use disorder. Now, the amount that is covered may vary, just from state to state or from program to program, and it basically depends upon whether the program is state funded, which will have lower costs, or if it's a private treatment facility, which may have higher costs or not take all insurances. So we will go through each treatment more specifically, but at first I just wanted to address withdrawal, give you guys a definition for it. So alcohol withdrawal syndrome, or AWS, typically begins between 6 and 24 hours after their last consumption of alcohol. You'll typically see it peak, so at its worst within 3 days, and then 5 to 7 days afterwards, you'll start to see a decrease in symptoms. It's worth noting that about half the people with alcohol use disorder will have symptoms of alcohol withdrawal when they quit. So, what are the symptoms of withdrawal? How do you recognize them? Well, the mild symptoms, the one you may commonly see, include anxiety, depression, fatigue, irritability, excitability, mood swings, and nightmares. More moderate symptoms are the ones now starting to affect vital signs, include sweaty, clammy skin, dilated pupils, insomnia, appetite loss, nausea and vomiting, and then tachycardia or increased heart rate and tremors. Perhaps most importantly, with withdrawal symptoms are the symptoms taken together known as delirium tremens. These are going to be agitation, fever, hallucination, seizures, and severe confusion. And this is the set of symptoms really to worry about. About 3 to 5 people with AUD will develop delirium tremens, and this is the set of conditions that are at increased risk of death relative to the others. And this is why we are concerned with patients going through alcohol detox alone. So that being said, let's go through some of the treatment options kind of step by step. The first one, or the first two really, are the inpatient-outpatient treatments. Notice that inpatient is typically more severe, so it is recommended for those that are at risk of moderate to severe withdrawal. And outpatient are recommended for those with mild to moderate withdrawal. And just broadly speaking, inpatient treatment is associated with higher success rates. The term can vary from either 28 days, so about a month, to 6 months, depending on intensity. And the big benefit here is the 24-hour support. Compared to outpatient treatment, they are associated with lower success rates. They'll run from 3 months to a year. They only have about 10 to 12 hour commitment per week, but they do permit a more normal daily routine. So it's about a balance as to what the patient would need in this case. So if you're at an outpatient treatment facility, what might you expect? Well, they're going to focus on behavioral therapies. So this might be anything from cognitive behavioral therapy, which helps patients recognize, cope, and avoid situations that might lead them to alcohol consumption, just kind of planning ahead. It might include family therapy, which is meant to improve family function and kind of address a whole bunch of influences that can impact substance use. They might even continue motivational interviewing that we discussed about with counseling for behavior change. And then, somewhat similar, they may even provide incentives to encourage abstinence. This could be like movie tickets or social events, and are thought to be beneficial. Now, with your inpatient treatment, you're going to get a combination of therapeutic environments and those similar practices for the outpatient treatment. So again, you might see therapeutic communities where they stay 24 hours a day, and this is to provide structure and support to the patient and kind of guide them through alcohol cessation based upon interactions with both staff and other patients. There are the shorter-term residential treatments, which really focus upon detoxification and providing some baseline counseling to help transition to the outpatient treatment. And then there are recovery houses. So these are supervised short-term residences that help people transition to independent life, and they'll provide social resources like helping the patient find employment if they need that, or integrating back with their family. It's thought to be a safe area as they get their foot back into life. So it can be confusing as to how to find appropriate treatment. I live out of Hartford, and so I went to findtreatment.gov and was just started looking at various treatment facilities within the Hartford area. I set it to 25 miles. There's a whole bunch of options you can include, and I just picked a few to showcase here. So I picked both, I picked all treatment types just to see the options. But note there's also special programs to protect special populations, whether you're a veteran or a member of the LGBTQ community, or if you need additional services such as being deaf or hard of hearing. Likewise, they also include options like medication assistance to go along with the inpatient or outpatient treatment. And then I just included a little highlight from a particular service without trying to, showcase one in particular. So based off this, the services they include are all listed, and so it's substance use treatment, transitional housing, which is the halfway house, or sober homes, also being able to treat serious mental illnesses along with substance use disorders. And then finally, they discuss what payments they take. It's also the website and contact information is also included. So this is what I want you to be comfortable doing with your patient, pulling up the website, using their demographic information to help find them a treatment that's suitable for them. So moving on from inpatient or outpatient treatments are the pharmacotherapies or the medications. It's worth noting only about 10% of people with AUD actually use pharmacotherapies, and so it should be brought up more often. These are things that have proven to help, um, and our patients should take advantage of them. Now, there's currently 3 FDA-approved medications: acamprosate, naltrexone, and disulfiram. Have all been approved, but disulfiram has inconsistent evidence, so I would not necessarily recommend that. The other 2 that have off-label use are topiramate and gabapentin. So overall, I've just listed the uses on this slide. On the next slide, we're going to go into what exactly these drugs are. So just going through the drugs in more detail, you have acamprosate, which is going to help with withdrawal by decreasing glutamate activity and increasing GABA activity. Naltrexone is going to take the pleasure away from drinking by blocking the opioid receptors. Disulfiram, it's going to inhibit the metabolism of alcohol and kind of give your patients an instant hangover, so cause some nausea, sweating, flushing, and tachycardia. And then you have topiramate and gabapentin, so these are anticonvulsants, so they help with epilepsy and seizures. And they're going to increase GABA activity, similar to acamprosate, while gabapentin will also decrease glutamate. All right, so we're moving on to mutual support groups. It's worth noting that peer support groups are effective with pharmacotherapies, so the use of them together is shown to be more effective than either alone. It decreases the risk of relapse, and it's thought to do so due to the sober context or just being around people who are sober. And then also engagement is associated with increased treatment success with those pharmacotherapies. Now we're going to focus on 3 particular groups here, but there's plenty. They each have their own different flavor. So the first one's Alcohol Anonymous, and this is your 12-step program. It's the largest throughout the United States and Canada. There's SMART, which has these 4 guiding principles based on scientific understanding of addiction. And then we have Moderation Management, which I included because rather than promoting abstinence, it promotes moderation and uses guidelines and goals to help achieve moderation. So if your patient expresses interest in Alcohol Anonymous, I just wanted to share their website with you. It's also in the syllabus. It's really simple to find a meeting near you. This is the landing page. You can see that all you need to do is put in a zip code or postal code or a county for the state, and then search away, and you should be able to find meetings. Now, some meetings may be open, meaning they're accepting new members. Some may not. You just need to go through the options to find a suitable meeting for your patient. Likewise with SMART, again, super simple, included the link here and in the syllabus. Again, you put in your zip code, you put in your state and your city, and you should be able to find meetings near you. And it does have the disclaimer that a lot of them are online right now due to COVID-19, but that will hopefully be not too long. And then finally, the last one, Moderation Management. Again, easy to find the particular meetings. In this case, they offer phone meetings, video meetings, and face-to-face. When you go into the directory, you'll provide your general location, and it should help you find a particular meeting. So last but not least, I just wanted to go over the idea of medical management counseling. So this is just a follow-up in the primary care setting. And I wanted to highlight it because they're still your patient. So they're still going to come in to see you, and you want to provide feedback on changes in laboratory tests that you see or in some chronic medical conditions, and use that time to increase their motivation, keep them on that upward trajectory. If they're improving or going towards moderation, you can always say or recommend abstinence as a goal to work towards, but not something to adhere in that moment. You can also monitor for medication adherence to see if that will help with their alcohol cessation. And then always encourage them to see other treatments. It's not a one-size-fits-all for any patient, and you can be their biggest ally by continuing to do this.